Hello, I am Cecilia Martinez and I am the gastroenterologist at the Campbell Pediatric Center, and I specialize in digestive disorders in children. Any children who have serious digestive issues in the area are referred to this clinic. This case study focuses on irritable bowel syndrome. The main symptoms include abdominal pain, excess flatulence, diarrhea, and in some cases, mucus found in the patient's stool. Our clinic sees approximately 1 or 2 in every 10 children that have some degree of IBS. Some common means of treatment at our clinic include a scintigraphy, anorectal function testing, defecography, avoiding foods that trigger your symptoms, eating high-fiber foods, drinking plenty of fluids, exercising regularly, getting enough sleep, or even eliminating certain types of foods like FODMAPs and gluten. IBS is caused by muscle contractions in the intestine and are triggered by the food that is consumed and by stress as well as hormones. It can persist long-term if these triggers are a continuous factor in the patient's life. My patient Emily is a young girl who has developed prominent irritable bowel syndrome at the age of 10. She and her family are Hispanic in the economic middle class. She has previously experienced gastritis, gastroesophageal reflux disease, and reoccurring pyrosis. As previously mentioned, Emily is diagnosed with irritable bowel syndrome and has been referred to a dietitian that can go into depth about a new diet and lifestyle to help with her digestive issues. I recommend stressing all the different environmental factors that can lead to irritable bowel syndrome that can sometimes be overlooked, like the stress levels of the patient as well as the hormone imbalances that can cause uncomfortable muscle contractions, to health education classes to attempt to reduce the amount of people affected by this disorder. Perhaps an interesting topic of research could be analyzing the stress levels of past generations compared to this generation, since IBS, irritable bowel syndrome, is more common now than it was years ago. Another interesting topic could be analyzing why irritable bowel syndrome is more common in the younger population than it is with the older population. I think it is essential to convey to other health professionals that they stress the importance of a good diet and exercise and lifestyle to aid with high levels of stress that a patient may have if they have irritable bowel syndrome. I believe that improving these qualities in life can have a very significant positive impact on the wellness of any patient with irritable bowel syndrome.